What inspires change? What motivates us? It's what's inside that moves us. What moves you? Get the Scion story at scion.com.
According to the Department of Public Health, over 40 cases of hand, foot, and mouth disease have been reported in 2013. 27 of those cases happened in August. And while cases have been scattered around the island, the most reported ones were in the villages of Jigo, Barragata, and Dedido. A majority of them were children under the age of 5. Seventh-day Adventist Clinic Medical Director Dr. Michael Robinson says the increase in the highly contagious viral infection has been more noticeable now than in the last 6 months. He says that their facility, they continue to remind people to take good care of themselves and their children.
So when parents come in and have concern about this with their children, so we ask them to make sure they're doing hand washing, and when a child uses the restroom, use hand washing. Before they eat, we encourage them to wash their hands. And then just regular, normal, healthy hygiene.
While Robinson notes daycare establishments are the most prone to getting the disease, it's not the only place.
Certainly at home, if we are in close contact, sharing cups or not washing our hands, we can share it. If we're sneezing or coughing, we can share it. So if you want to cover your mouth when you sneeze, and use a napkin or tissue to blow your nose, and wash your hands really thoroughly.
Parents should look for symptoms that include fever, sore throat, painful sores inside the mouth, red rash on hands, feet, or butts, or loss of appetite. Symptoms last up to a week, and the recovery period is rather quick. However, the virus can remain in the body for weeks. Robinson mentions once a child gets it, he or she will be immune to it as long as it is the same virus. Adults can also get hand, foot, and mouth disease if they didn't catch it as a child.
It's interesting, with adults it's usually milder than with children, and the kids tend to get a worse case of it.
Although there is no vaccine, Dr. Robinson adds it's important to make a child comfortable and well hydrated for the duration of the disease.
It has to run its course, yeah. So the main thing is supporting the child, make sure the child stays healthy during the viral illness.
Little Big Playhouse Learning Center in Mighty is one of the daycares that dealt with a few cases of the disease early on. However, Child Care Director Jean Awa says for the month of September, no recent cases have been reported. She also says for their establishment, which serves children 1 to 12 years old, they continue to enforce strict cleaning and safety procedures.
We clean as we go. We don't wait till the end of the day to wipe up something, sweep up something, or vacuum. We clean as we go.
She emphasizes anytime a child is contagious, he or she cannot come back to the daycare without clearance from a doctor. She describes some of the ways they sanitize the areas children play in, which includes wiping down the walls with a Clorox and water solution and upkeep of their kitchen and bathrooms.
Everyone, wears gloves, whether they handle food or change dirty diapers. The staff's hair is usually tied at all times. We do have indoor and outdoor shoes, so that way the kids don't bring in outside dirt.
She also asked parents not to blame daycares or schools if a child gets the airborne virus because anyone can be a carrier and it can spread from almost anywhere. However, she reassures parents their priority is the children and they always take preventative measures to safeguard them.
When something comes up, we are aware, we are concerned, we do care for your child, so we will try our best to prevent it from spreading and to make sure that your child is safe at all times.
Josh Tukanko, PNC News.